Welcome back, guys, to the hypertrophy series. And firstly, I just want to thank you all for the feedback and the awesome response that we've had on previous videos related to this series. And today we're going to be talking about the upper body, give you guys a basic overview of the anatomy and functions of each muscle group that comprise the upper body, so the chest, the back, the deltoids, and the arms. We're going to look at exercises that will allow you to maximize growth of each muscle group. We're going to categorize them again into priority 1, 2, and 3 in order of their importance relating to hypertrophy, as well as their highest force producing actions at that muscle group. We're going to be talking about some applications in program design, so frequency, loading, zones, and repetition ranges, and I'm going to give you guys some key tips for training each muscle group effectively. So first up, we have the chest. Anatomy of the chest is pretty simple. It's got two heads, the sternal head and the clavicular head. So the sternal being the lower chest and the clavicular head being the upper chest. Now we can't isolate any particular portion of the chest. However, there are some movements that will train certain fibers more so than others, and we're going to talk about that in a second. But the functions of the sternal head are that at the shoulder it's responsible for transverse flexion and adduction, so think of your bench press, internal rotation and adduction, and shoulder extension. At the scapula, it's responsible for downward rotation, depression, and adduction. And the functions of the clavicular head are very much the same, as well as shoulder flexion and abduction. So, priority 1 exercises for the chest, multi-joint movements, barbell bench press, dumbbell bench press. EMG data even suggests that dumbbells involve less triceps than barbells, which could be very useful in terms of the exercises we select for chest hypertrophy. Incline barbell bench press and incline dumbbell bench press. Now, an important note in training the chest, the more of an incline we do have, the more of those upper fibers, the clavicular head, we will train. So if you're performing a flat bench press, you're going to be training the whole chest, predominantly more sternal fibers, whereas if we have an incline at a 30 degree, 45 degree, we work up the chest and we start to get a little bit more upper pec recruitment. So really important to keep that in mind when you're selecting these exercises. Typically, I like to have one incline variation with one flat variation within a program because this allows us to train both heads pretty evenly. Now, when it comes to those priority 2 exercises, these are your cable chest flies, your pec decks, all of those movements that are responsible for adduction. Now, these movements, whilst priority 2, they could be a priority 1 movement if you're somebody who is needing to prioritize your chest development or you're looking to specialize and build your chest. But they're priority 2 movements simply because you can get a lot of tension stimulus out of those big barbell movements and dumbbell movements, and these isolation exercises are going to produce less tension stimulus, simply complementing the movements that we spoke about earlier. Priority 3 exercises are your dips. Now, the reason they're priority 3 exercise is a lot of people do have trouble getting into position, performing this movement properly without getting any shoulder impingement. So they're not necessarily a bad movement, just for some people they have a really hard time performing it properly, which is why they're a priority 3. In terms of program design, frequency for the chest, anywhere from 2 to 4 times a week. Beginners might need to practice and train their chest a little more frequently so they become proficient at the barbell movements, whereas advanced athletes, they're able to ingrain those patterns. They're going to produce more force, create more disruption. They might have longer recovery curves and may need to train towards the lower end of that spectrum 2, 3 times a week. But again, anywhere within that range is a good starting point. Volume for the chest, starting with 10 to 20 sets, split across the appropriate frequency for you, picking 1 to 2 priority 1 movements, and then again 1 P2 movement, and if you're going to incorporate dips, simply add that in as your final movement, so 3 to 4 movements total per mesocycle. And just remember that with variation comes the trade-off for specificity. So if you want to get really good at the bench press and you need to work on your technique there, you might need to bench press more frequently, whereas if you're pretty advanced, you might be able to have a higher degree of variation within a single mesocycle. Loading zones and rep ranges for the chest, common sense will dictate here, 5 to 10 reps for those multi-joint movements, so your bench press, your incline barbell presses. You can go higher, you can go lower. There's no need to stay within that rep range specifically, but this is what I would recommend based on the research, my experience for training the chest and working within 10 to 20 reps on those single joint priority 2, priority 3 movements. Again, heavy dips may not necessarily be a good idea for someone who has beat up shoulders. You're performing a lot of heavy bench work. You might need to go lighter and work within some high repetition ranges there. So some training tips for the chest: use a full range of motion if you can. So training through a stretch position is a really good idea for the chest, because the pecs will respond very well to that load through a big stretch at the bottom of your bench press, flies, all the rest of it. But just consider your shoulder mobility, your scapular and thoracic control, and your strength and control in that range. So a lot of people do have certain issues and abnormalities at the shoulder, which cause them to really struggle to get full range of motion without any impingement, pain, or discomfort. And this usually comes from a lack of thoracic extension. So thoracic is the middle of your back, essentially. You need to be able to extend your thoracic spine, retract and depress, so rolling your shoulders back and down, and getting those scapula nice and tight for those pressing variations. Considerations with the bench press: range of motion. If you're looking to build your chest, you probably don't want to go too wide with your hand position. This is going to create a really efficient and strong bench press, which we would see typically with a lot of powerlifters. But again, with that comes a decrease in range of motion, which just means more volume, because you know that volume is a function of the number of reps, sets, load we perform, but also the distance that we travel through that repetition. So just bear that in mind, and also consider, how close your hands are. If you're going too close, you're going to get significantly more tricep involvement. So somewhere in the middle is usually a good starting point, so that we can get that nice range of motion, and we're going to make sure that plenty of stimulus is on the chest. Again, like all barbell movements, there is a skill component to these movements. So make sure that you're working on your technique so that you can use a sufficient stimulus over time. So practice, 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 and when you are practicing and you can't use significant loads or volumes because you're working on your technique, potentially getting more volume, tension, load through those lower skill movements such as your cable flies, your pec deck, things like this. Quick tip: if you can't feel your chest, activate it. So simply performing some prayer push downs like this, you were seeing plenty of bodybuilders do that, and squeezing your chest could be really useful before you perform your bench press variations. Not that you need to feel your chest when you're benching, but sometimes it's a good proxy that the stimulus is going to the target muscle group if you can feel your chest doing something. But again, now we're going to talk about the back, which is comprised of the lats, the traps, and the rhomboids. So starting with the boring, the basic anatomy of the lats, responsible for shoulder, adduction, extension, internal rotation, and transverse extension. For all you exercise science nerds out there, you'll know what I'm talking about. If you don't, check out exrx.net. They've got plenty of good info on there. And then also the lats are involved at the scapula for depression and downward rotation, as well as adduction. So the lats are strong shoulder adductors when the shoulder is externally rotated, and it's a strong shoulder extensor when it's in a neutral position. So this is very important in terms of our hand positions when we're performing certain movements, and we'll get into that in a second. So now on to the rhomboids. The rhomboids perform a couple of things: adduction and downward rotation of the scapula. And then the traps, we've got three sections of the traps: the middle, the upper, and the lower. So the middle is responsible for adduction, elevation, and upward rotation, whereas the upper portion of the traps is responsible for scapular elevation and your cervical spine extension, so this movement here. And the lower traps are responsible for scapular upward rotation, adduction and depression, and thoracic spine extension. So lots happening at the traps. But more importantly for you guys, in a practical sense, what does this mean? What exercises should we choose, and why? So again, starting with our multi-joint movements, priority 1 exercises. Break that down into two components. We have a horizontal row and a vertical pull. And this will just maximize your back development, because these are the primary functions of the upper back, and it's going to train pretty much all of those muscles within the back, with a few caveats to that. So your horizontal row movements, break them down into supported, where you're prone, you have your chest supported on a bench, such as a prone dumbbell row, prone barbell row, or a seal row, or unsupported, such as a cable row, a barbell row, or a pen lay row. So, depending on your level of advancement, your mobility, stability, and how well you can hold those positions with certain loads is very important. However, for most beginners, when you're starting out, always start with supported movements or machine variations so that you can target your back whilst you're working on your mobility, stability, and coordination in the gym. And with these supported movements, you will get a lot more quote-unquote isolation of the back, because you're not going to have other muscles involved anywhere near as much as you would if you're performing an unsupported rowing variation such as a barbell row. But again, progression for these would be to start with a seated cable row, move to a prone dumbbell row, prone barbell row, seal row, bent over barbell row, into a pen lay row, so on and so forth. But do consider your technique here. I'll get to that more in a second. And then we have our vertical pulling movements, and quite simply, you've got a pull up, so it could be body weight, assisted with a machine or a band, and then weighted, or pull downs. Your priority 2 exercises, stiff arm pull down, so function of the lat is to again extend the shoulder, and the pull downs are a very good movement to target this function. And then I've categorized single arm rowing variations or pulling variations into priority 2, simply from a time efficiency standpoint, as well as with those bilateral movements, we can get more training stimulus in a quicker time when compared to performing those unilateral single arm movements. So you can perform your single arm rows with cables or dumbbells, or you could perform pull downs with a single hand. Again, most people are pressed for time, so I do recommend the priority 1 movements, which are those bilateral movements, and those P2 with your single arm variations if you're somebody who has more time or potentially struggling to feel your lats. And again, we'll get into that in a second. And the final priority 2 exercise are your lat pull-ins. So frequency for the back is 2 to 4 times a week. Again, beginners will be able to train at the higher end of that simply because they need to master the skill, and they're not going to be causing too much fatigue, whereas when you become a little bit more advanced, you want to work down that range potentially 2 to 3 times a week. But do consider that the back seems to recover, the upper back, pretty quickly, depending on the type of movements that you're performing. Volume for the back, again, 10 to 20 sets per week, and 1 to 2 priority 1 movements from your horizontal row category, and 1 to 2 movements from your vertical pull category, with an optional P2 depending on your level of advancement, your time availability for training, and things like this. Loading zone and rep ranges for the back. The back does seem to respond pretty well to a combination of both heavy and light training. So 5 to 12 reps for your priority 1 movements. The bilateral work always lends itself better to heavier loading zones when compared to unilateral work. And 12 to 20 reps for those P2 unilateral exercises. But there's no reason why you can't train your rows for more than 12 reps, but 5 to 12 reps is just a good starting point. And do consider the free weight exercises will place more demands on other muscle groups. So if you're performing bent over barbell rows, you're going to be recruiting your erectors, all of those muscles, and that's going to cause some fatigue, which could carry over into your following day if you're training legs, got a deadlift session, and that can be problematic. So do consider this when you're selecting these exercises and you're programming for yourself. But more importantly, the tension curve with these rowing and pulling variations are such that the tension curve becomes hardest when you get closer to the midline of your body. So for example, if you're performing a row, when your arms are extended out in front, it's going to feel pretty easy. You can perform that rep, no worries whatsoever. But as you come closer to your chest, the joint angle closes and the movement becomes significantly harder. What this means in practice is Don't select weights based on how easy it feels through that top portion of the rep, but more so how hard it is through the final stages of the rep where the back is working the hardest. If you're selecting loads and you simply can't retract to press your scapula when the cable's getting close to, or the dumbbell or the barbell, then you're inappropriately choosing weights, and that's not going to place a significant amount of tension on your back, which again is going to limit your gains. So you need to make sure you're selecting weights that you can train through a full range of motion, even when the tension curve gets harder as you come towards your midline. So do keep that in mind. Same goes for your vertical pulling exercises. Final tip, when you're training your back, do consider different hand positions and what they mean. So we have pronated, which is palms down, supinated, palms up, and a neutral grip. So with your pull downs, EMG studies have shown that a pronated grip with mid hand position, not too wide, not too narrow, recruits the lats the most. And when we're performing a supinated grip, we will get significantly more bicep involvement. So again, horses for courses, you just need to think about what you're trying to get out of this movement. And again, with the neutral hand position, for most people, this actually allows them to retract and depress their scapula most effectively. So starting with a neutral hand position, then potentially to a supinated position, and then a pronated grip is a useful progression that I use with a lot of my clients to great effect. So again, make sure that you're thinking about this when you're selecting your hand positions for your rowing variations. Moving on to the delts. So the delts have a number of heads. We'll start with the anterior deltoid, so at the front of the shoulder, and the anterior deltoid is responsible for abduction, flexion of the shoulder, transverse flexion, and then internal rotation, so this here. And it gets a lot of indirect stimulus via the chest, and when you're performing those pressing movements from your chest training, so it is important to consider this. You may not need to train your anterior delt directly because of that. You've got the lateral delt, which is responsible for abduction, so taking your arms away from your body, flexion of the shoulder, so above your head, and then transverse abduction, and the posterior deltoid, which is at the back of your shoulder, the one that's responsible for that peaked deltoid and that capped look. And the posterior delt is responsible for shoulder extension, transverse abduction, and external rotation. So a number of functions are happening at the rear delt, and the priority one movements for your shoulders are your lateral raises. So all of your raises, whether it's dumbbell, kettlebell, cable, all very, very important because the lateral and the posterior delt are the ones we're going to predominantly be focusing on, because like I said, the anterior delt gets plenty of tension when we're doing our pressing movements, so we don't need to train it too much directly. So lateral raises. Secondly, your rear delt flies, whether it's with a cable, reverse pec deck, or dumbbells, and then face pulls, one of my favorite movements for both the lateral and the rear deltoid. Your priority two exercises here are your anterior delt movements, such as an overhead press, whether it's with a dumbbell, a barbell, or a Z press. I'll do a video on that one shortly. An Arnold press, an upright row, whether it's with a cable, dumbbell, or barbell. Just consider with your upright rows, the risk for shoulder impingement increases when we go beyond 90 degrees, so the humerus comes up past parallel to the floor. And in terms of program design for the delts, frequency, 2 to 5 times a week. It's a small muscle group, we can train it more frequently, and we can use more volume spread across greater frequencies. So 15 to 25 sets of direct training for the lateral and posterior deltoid. Just be mindful of how much pushing volume you have. Selecting 2 to 3 priority 1 movements and 1 to 2 priority 2 movements. So your loading zones and rep ranges for the delts, typically more type 1 dominant, so they produce less force, respond really well to higher rep work and metabolite type training, so it's really effective to incorporate higher rep ranges and also some other strategies such as supersets and giant sets. So 10 to 30 reps for your P1 movements, and then for those P2 exercises, which are compound in nature, 8 to 15 reps. But do consider some joint issues when you're performing a lot of side delt and posterior delt work. Overuse injuries and issues arise if you're performing the same exercises really frequently. So do consider having a little bit more variation with your shoulder work. And again, it's a low skill movement. It's not too hard to master a side raise, so you shouldn't have too many issues learning how to do that, putting some weight on there, and going at it. So in terms of training the delts, again, length tension curves vary depending on the type of exercise we perform. So a lot of people will perform only side raises, and they'll usually start at the hip or below the hip, so touching the dumbbells together, and then they'll swing up to the side, when in fact the lateral delt really only starts to be involved in a side raise from 30 degrees up until parallel to the floor. So if you're using a dumbbell or a kettlebell, you want to internally rotate your shoulder, because this is where the lateral delt will be recruited the most, and then raise through the scapular plane, making sure that we work predominantly through that 30 to 90 range. So no swinging, because essentially you're going to take out all the tension on the lateral delt, and it's going to mean a very ineffective stimulus. So we will train through a shortened position, so it's going to look like you're cheating the rep, performing half reps, but this is just an effective range of motion for the delts. Conversely, your cable side raises, where we perform them leaning from the pulley system, these will train the lateral delt in a stretch position, which is something we miss out on when we use free weights. So for complete lateral delt development, I do recommend using both dumbbells and a cable raise, so that we can train through both a lengthened and shortened position, because we know that training through a stretch position is really important for hypertrophy. Plenty of options and variety available to you guys when it comes to your delts, because we do have a lot of exercises, greater frequency and volume, so you can pick and choose which exercises feel best for you, but do consider length tension curves, proper technique, just as you would any other movement. Finally, onto the arms. So the anatomy of the arms comprised of two muscle groups: the biceps, the triceps. So the biceps actually have three functions, which people often forget about. So flexion of the elbow is the obvious one, but it's also responsible for supination of your forearm, and then shoulder flexion, so actually raising your arm up. And the triceps is simply responsible for extension of the elbow. So for the biceps, your priority one movements: dumbbell curls, barbell curls, cable curls, all of your curling variations. And for your triceps, your priority one movements are tricep pushdowns in shoulder extension, so when we have your shoulders down, and then training through shoulder flexion also when our hands are over our head, because the long head of the tricep is involved more when we get our arms up above our head than when we're in shoulder extension. So you want to be training through both shoulder extension and through shoulder flexion. Your arms can be trained pretty frequently, because they are a small muscle group, so 2 to 5 times per week. And volume recommendations for the arms, I preferably use higher volumes for the arms. I've seen a lot of great results personally and with my clients and athletes. So 15 to 25 sets per week of direct arm work, split across 3 to 5 sessions. And your loading zone and rep ranges, the arms will respond pretty well to a broad spectrum of rep ranges. So anywhere from 8 to 25 reps, very useful in training your arms. And some training tips for the arms: with your bicep training, make sure that you're incorporating some curling work when you're in shoulder extension, so an incline dumbbell curl, because this will train the long head of the bicep a little bit more than the shorter head, and then also getting some curling with shoulder flexion in there, so whether you're curling and then raising your arms slightly, or you're doing some high cable curls, this is very important if you want to maximize your bicep development. And again, just making sure that we are programming for completeness. And something I always teach my clients and athletes to focus on with their arm training is mind-muscle connection. So very small muscle group, we should be able to feel it, especially because we're training with higher reps. We're going to be getting more metabolite buildup in the muscle. We should be able to feel quite a bit of swelling, soreness in the biceps, triceps, if we're putting the tension on those muscles correctly. Again, timeless form is critical for your arm training, so no swinging. Make sure that you get tight, creating what's called irradiation, so full body tension, so that you can produce more force through those muscle groups and ensure the stimulus is going there. There's no cheating, no swinging, or no cranking out reps for the sake of it. That is the wrap for arm hypertrophy and this video. I hope it was useful. I hope you guys found it informative. If you did, like the video, comment below. And if you have any questions, feel free to ask, subscribe to the channel, and I'll speak to you all next time.